All right. Thanks, Rich. Well, now to a member of Congress who's been left out of these closed-door negotiations.
Tennessee Representative Republican Marsha Blackburn joining us. Welcome, Representative. Again,
good to be with you.
It's distressing that this isn't bipartisan. Of course, the Democrats would say that's because Republicans weren't playing along, but either way, it sure would have been nice to have some members of the Republican side in on this. That said, what have you heard and what are you expecting? Do you expect a deal within the next couple of days?
You know, it would have been nice if they had approached this in a bipartisan manner, which is normally done. What we are hearing is that they are trying to tax, and tax some more. And, of course, the way they are approaching the Cadillac plans tax, or basically that is a tax that is going to hit 1 out of every 5 American families now. And that is only going to grow over time because that's not indexed. And then we're also hearing they're looking at the exchange and how they're going to set that exchange up, and that it may end up being some type of hybrid. But there again, Liz, you're talking about more government control over the product you're going to get. If you like what you have, you're not going to be able to keep it, because they are not only going to change the products that are available, they're going to change the way that they're sold. And you're going to lose the opportunity to keep those choices that you may have had, the way you may have handled your health care in the past.
By the way, Congressman, because they have shut the public out of these negotiations, how are you finding out, how are Republicans who, in addition to the public, have been shut out, getting information about what they're planning to do?
Well, we are hearing via tidbits that are coming from staffers. We also are hearing bits and pieces that are coming from the news and are being reported. But isn't it so interesting? There's no C-SPAN. There is no part of the medical community. There are no Republican members of Congress. What you have is the House leadership staff in the White House that are crafting this deal. And it is going to significantly change about 1/6 of our nation's economy. It is going to insert a bureaucrat in the exam room between you and your physician. It is going to change the way you deal with health care, the way you manage your family's health care, what the options are, and primarily what the cost is going to be, because everybody, CBO, every economic think tank says that the decisions they are making, what they're trying to do, is going to cost you money, not only for your insurance premium, your taxes are going up, and guess what? At the state level, to implement this plan, we're talking about hundreds of billions of dollars.
There are some very liberal people who are extraordinarily unhappy, too, that C-SPAN and the rest of the cameras aren't in there, because they would like things changed as well. So this isn't just the Republicans. But looking forward and seeing exactly what might happen, there are those who would argue that insurance companies already came between a patient and a doctor, and I've personally experienced it firsthand, and my dad was a surgeon. He said he'd get these calls. It was ridiculous. They wouldn't agree to certain things. They would to others. It was all penny wise, pound foolish. Can't something good come out of figuring out a way to broaden the coverage to more people in this country and bring the cost down as the numbers then go up?
Liz, something good could come out of it, and something should, because you're exactly right. Frustration with insurance company bureaucrats is what has driven a lot of the unhappiness that people are seeing in their health care plans. But they don't want to add a government bureaucrat to that mix. What they want to do is to have greater control individually and be able to work with your physician and make those decisions, and to have the insurance company have to make good on the product that they sell. And that is the simplification that is desired from the insurance market. And what we are seeing come from the Democrats is something that is going to convolute that process. It is going to make it more difficult. It adds extra layers of bureaucracy. And guess what? It's going to bring about rationing, because they're going to control the amount of health care that you can actually access.
Marsha Blackburn, representing the great state of Tennessee, thank you very much for being with us. Appreciate it.
Thank you.
So good to be with you. Thank you.